Hi everyone, Ron Crider reporting for duty today. It is Saturday, January the 16th, a little bit past the middle of the month, 3 o'clock in the afternoon. Got some new numbers in here. Not such good numbers. Of course, the positives came down and the deaths went up. That's not a good thing, so let's take a look at them. For the entire state of Florida, 207 new deaths in the past 24 hours. That's 22 more than yesterday. Yesterday, we had 185. As far as the positives go for the entire state of Florida, 12,119. That's down by 4,756 over yesterday. Yesterday, it was 16,875. All righty, let's take a look at Dade and Broward County. First, take a look at Dade County. 33 new deaths in the past 24 hours, 2,408 new positives. And then we had 8,360 new vaccinations in Miami-Dade in the past 24 hours. Let me go back up here to the entire state of Florida. So far, Florida has vaccinated 937,630 people. That's the whole state. But in the past 24 hours, we've vaccinated 88,313. Okay, now, Broward County. Broward County's Fort Lauderdale. 2 new deaths to report in the past 24 hours, 1,138 new positives. Broward County has so far vaccinated 85,294, and in the past 24 hours, 7,609. Palm Beach County, 15 new deaths to report in Palm Beach County in the past 24 hours, 658 new positives. So far, Palm Beach County has vaccinated 75,328. In the past 24 hours, they vaccinated 7,454. In Orange County, that's Orlando, 4 new deaths to report in the past 24 hours, 813 new positives. 56,172 vaccinations since we started vaccinating up there in Orange County and Orlando, and in the past 24 hours, 3,896. In Brevard County, 6 new deaths to report in the past 24 hours, 246 new positives. Brevard County has vaccinated 22,650, and in the past 24 hours, 1,689. Alrighty, folks, here in St. Lucie County, 1 new death to report, 174 new positives. St. Lucie County has vaccinated 11,043 since we started vaccinating here, and in the past 24 hours, they vaccinated 2,534. In Martin County is Stewart, 2 new deaths to report in the past 24 hours, 51 new positives. Martin County has vaccinated 7,044 since we started, and in the past 24 hours, 582. Here in Indian River County, Vero Beach, no new deaths to report. Good thing for Vero Beach. 82 new positives. And Indian River County has vaccinated 6,557 people, 482 in the past 24 hours. Now, let me give you this chart over here. This is going to tell you a little bit about the zip codes here in Indian River County. For the Vero Beach area, zip code 32948, 2 new positives in the past 24 hours, zip code 32958, 11 new positives, zip code 32960, Vero Beach proper, 17 new positives, zip code 32962, 17 new positives, zip code 32963, that's here on the Barrier Island in Vero Beach, 8 new positives, zip code 32966, 13 new positives, zip code 32967, 12 new positives in the past 24 hours, and zip code 32968, 1 new positive in the past 24 hours. I'm going to take you down here and show you this other chart here. All sorts of great information down here for you. So let's take a look at the entire United States. The United States has so far distributed to the states 31,161,075. So far, United States has administered 12,962,550 shots in people's arms. And in the past 24 hours, the United States has done 1,093,072. Those are the number of vaccinations that were done in the past 24 hours. Texas has vaccinated 116,618. California has vaccinated 97,666 in the past 24 hours. Florida has vaccinated 82,014. I always tell you this number is a little different than the number I showed you up there just because it comes from a different source. Rhode Island, 3,102 in the past 24 hours for vaccinations. Colorado's vaccinated, look at this number. In the past 24 hours, they vaccinated 17,527. That is pretty amazing. Wisconsin, they vaccinated 17,864. Minnesota, 18,569. New Jersey, they vaccinated 16,857. And New York, 59,901. Those are the number of people who have been vaccinated in the past 24 hours. So they're really beginning to get some of these shots out there. They were blaming the government. The government is not at fault for getting these vaccines distributed. The problem is that the states weren't quite sure what to do. They wanted to hang on to them because they know they have to administer a second dose of these, and they didn't want to be caught by giving all of the shots away and then not being able to give people their second shot, which is very important. That has to come in at a relatively reasonable period of time within, I believe, 2 weeks if you're having your first shot, or 3 weeks, or whatever it is. I haven't gotten mine yet, so I don't really know. And so they were very concerned about that. Well, as it turns out, the vaccine seems to be rolling out pretty well. The states are actually getting it. The problem is the states aren't doing a terrific job of getting it out there, and there's all sorts of haggling going on in the various states. But it's not a federal issue. It's more a local and state issue. Number of deaths in the past 24 hours for the entire United States, 2,434. In Texas, 415 48 hours ago. I don't have the current number of deaths for today. Now, today in California, it was 40. Very low number for California. Today in Florida, it was 207. Rhode Island, 48 hours ago, was 9. Colorado, 48 hours ago, it was 31. And today in Wisconsin, 128. That's 24 hours ago. Minnesota, 37, 24 hours ago. New Jersey, 87 24 hours ago. Those are big numbers up there, Danny. And 150 up there in New York in the past 24 hours. The darker number shows you that the darker background color means that that's current. That's today. The lighter numbers means that I didn't get new numbers in, so those are the numbers that are here from yesterday. Alrighty, folks, let's go over here and take a look at what I refer to as the worst possible. These are the really big global numbers, and just kind of give you an idea of where we are. But the total number of cases since we started here in the United States, 23,644,885. Total number of deaths. So we look at this. We're closing in on 400,000 for the USA deaths, 393,965 number of people who passed away as a result of COVID-19. It's not anything to laugh about, but people keep saying, well, no one's died now in the United States since March of anything but COVID-19. I don't think that's necessarily so. It's not a very good joke. You shouldn't joke about people's deaths, but bottom line is there is a lot of questions about some of the people who were in motorcycle accidents and gotten written up as dying from COVID-19. Not a good thing. It doesn't make any difference when you're dealing with numbers this large. That's always going to happen. Somebody's going to take advantage of the situation. It doesn't make it right, but it is going to happen. And they're few and far between, but nonetheless, we are hearing about them. So just remember that some of these aren't exactly the way they're supposed to be, but that's the only thing we have to go on. Now, this number up here, this 94 number, this is the worst number on the whole thing with respect to the biggest number, 94,227,987. Those are the global cases, number of cases in the entire world, 94,227,987. Now, as far as I'm concerned, the very worst number of all on this sheet is this one here for the global deaths, 2,016,860. 2,016,860 people have passed away as a result of COVID since this whole thing started. Now, another little thing that popped up here, and this was in 32963 today. Let me stick my glasses on, and you probably have already seen this, but it's probably good to know. An average of 125 new infections daily have reported last week, 8.7% higher than the previous week. For comparison, an average of 55 people per day tested positive during the surge in July. So our numbers are up quite a bit. We're down to a range of 36 to 46 patients in the hospital, and that's not a good thing either. So our hospitals are filling up here, and these positives are growing like crazy. So once again, I need to tell you, I say this every day, this is really an important thing. We are the ones that are causing this pandemic to continue. We're pretending our lives are just as way they were last year. Nothing's changed. Go out to the restaurants, hang out at the bars, and wonder why we got COVID-19. And I have to remind you one more time. This is so important. Please understand this. This is not like the flu. It is absolutely not like the flu. You may end up with underlying medical issues like respiratory problems, heart problems, all sorts of things. With the flu, you get it, you get over it, and you almost forget you ever had it. With COVID-19, this guy can linger around for quite some time. We don't know how long because obviously he's only been around for 9 months. But a lot of people, many people, and we're talking about as many as 1 in 10, 1 in 15, have these underlying health issues that are lingering on after they finish, after they are no longer affected by it from the standpoint that they don't have COVID-19. They have other issues like these heart problems and so forth. So don't just think, well, so big deal, I get it, no big problem. Well, it's a big problem. And let me tell you, the other big problem here in Indian River County is a lot of us are still trying to figure out how to get our shots. I promised last week I was going to tell you exactly how to do it. I said, I'll let you know on Monday or Tuesday. Well, sorry about that because it hasn't been that easy. And it should be easy for me, for heaven's sakes. I'm 79 years old, almost 80. I should be able to get it. I have prostate cancer. So I should be able to get on that list and be able to get it. But every time you start getting on the phone and trying to call, bang, the number's busy. Sorry, we're out of all the shots. Call tomorrow. It's not quite as easy as we had hoped. Now, as we know, Publix is supposed to start being able to put those out as well, but they say they're only going to have about 120 a day. CVS fairly soon will begin to have them as well. And of course, the county does some out at the fairgrounds. So just keep watching the newspaper. Keep listening to this. I'm digging some more. I hope by Monday or Tuesday, as I said last week, but I'm going to try again. I hope I will be able to get those numbers for you and tell you exactly how you can get in line. I mean, if you could just get on a list and they'd say, okay, it'll be 3.5 weeks, then you can come in, that would be a good thing. But not being able to get on any list, that's really bad, really bad. And I feel bad for the people who are even in worse shape than I am. I'm in good shape for the shape I'm in, for heaven's sake. So I'm not as concerned about it, except that I want to get it as soon as I can get it. I don't want to displace anybody else that's older than I, but nonetheless, I definitely would like to get it. All righty, folks, enough preaching for one day here. It's Saturday. It is the 16th of January, and I hope you will give me a like if you like the report. If you don't like the report, I guess you'll have to give me a thumbs down. I get 1 or 2 of those every day, by the way, a thumbs down. I do get those, yes, absolutely. Generally, it's pretty much the same people who give me the thumbs down. But why, if you don't like it, don't watch it, for heaven's sakes. Why do you tune in every day and give me a thumbs down? It's going to get much better than it is the way I do it right now. Hope you have a very blessed Saturday. Look forward to seeing you back here on Sunday. Ron Crider signing off for Saturday. Have a great evening.